talking about drug use and misuse, and the number of drug-related deaths in Northern Ireland has trebled in 10 years.
Yes, this is according to a report from Queen's University in Belfast, who've said that the number of drug misuse deaths have risen from 61 in 2011 to 175 in 2021.
So you put that together and it means that Northern Ireland has the second highest rate of drug-related deaths in the UK. That's after Scotland.
Well, joining us now to tell us more about it is psychiatrist and expert on addictions, Dr. Niall Campbell. Good morning to you. What would be behind?
Everyone.
Good morning. What would be behind such a significant rise over the last decade, do you think?
Well, I think that drug deaths in the UK, all over the UK and the world, are going up, and Northern Ireland's catching up. Why should they miss out, as it were? We're seeing the biggest number of deaths in the UK and Northern Ireland is from opiates, which of course are very toxic, but increasingly popular, cocaine, more ketamine, with alcohol. I had a young man in the Priory recently from Northern Ireland, a rural town. There's only a few pubs there, and he said you can get cocaine in 5 or 10 minutes. It's astonishing. And he's on 2 or 3 grams of cocaine at night, and he's drinking, I'm not joking, 10 or 12 pints of Guinness. So off we go, you can just drink more.
But the question, Niall, is why? And you mention a rural town there. So we're not talking about Derry, we're not talking about Belfast here. We're talking about Auchnacloy, we're talking about Enniskillen or whatever it is. Why?
Yes. Well, it's fashionable. It's popular. The other funny thing that's popular in Northern Ireland is a thing called pregabalin, which is an anti-epileptic drug, which is a bit like Valium. People, the kids take handfuls of it. They can sort of steal it from the cupboard at home. There's a bit more disposable money, weirdly, but the consequences to the physical health of the young people, to their mental health, they're getting more depressed, they're more paranoid, relationships with others, their relationships with the drugs, and of course work and money. Yeah. These things are not cheap, and they're funding the kind of people that supply it, who are not very pleasant.
Niall, when you're talking about drugs, and this will be enough to put me off, but you talk about that ketamine, and then that is always connected to the term a horse drug. You know, it's a sedative for horses or whatever it is. You see, I would look at that and I would think, oh, no. Why is there attraction? Why do people not seem repulsed by ketamine?
Well, it's got this reputation. I can't remember who first said that. Horse tranquilizer. It's a mammalian anesthetic drug, which is also used in humans. Not particularly popular anymore with anaesthetists, but it can be a great anesthetic drug in an emergency and certain procedures. You can't have a general anesthetic. So it's a downer. So if you see them staggering about in the streets, falling all over the place, they're probably on drinking ketamine. If they're pinging off the walls, chatting rubbish, they're on coke and alcohol. And of course, sometimes they mix it. It's the great crack to go out for the evening, and you have a few tokes and a spliff, and then you have a bit of ket and a bit of coke, a few bumps of coke and a few drinks, and that their brains are completely fried. Yeah. And they're falling about all over the place. You know, usually they're too stoned to fight, but it's a catastrophe. It's an epidemic, and we are in Northern Ireland. We're catching up.
And our ability in Northern Ireland to cope with drug abuse is poor. The funding is poor. There's no government in place, as you know as well. I have seen clinics, I've been to clinics whereby people lie in corridors, and this is left to the voluntary sector to deal with, and there's just a line of people outside who are addicted, who are overdosed, and there's nothing pretty about it. There is this whole thing about it's a social thing for the middle classes on a Saturday night or whatever, and then there is a whole other plague there as well.
Well, yes, so it's no longer just up the Malone Road. For listeners in the mainland, that's the equivalent of Knightsbridge. That's where cocaine used to be, but it's everywhere. So why shouldn't they have it in Auchnacloy, Enniskillen and Ballymena? Not fair. We should have a bit as well. and that the problem continues. Opiates used to be the main issue back in the 80s in various towns, including my hometown, Ballymena, but that's still a big thing. Tends to be you're either opiate user or cocaine and ketamine user. But and as you say, the government provision is poor, but AA, NA, CA is free, it's online, help is available if people want it.
Just a final...
And most people who get clean use the fellowship meetings.
Yeah, just a final thing, Niall, about opiates. I've had terrible back problems over the past couple of years, and I've found that opiates work quite well in terms of pain relief. But getting a doctor to prescribe me an opiate is nigh on impossible. Where the heck do they get opiates from?
Well, chemists and wholesale chemists are quite leaky. If you can pay for it, you can get anything. So if you want tramadol, if you want oxycodone, you can get them. And of course, if you want heroin, you can get it off a guy. He might be wearing a balaclava, or his boss is wearing a balaclava, but you can get it. And there's plenty of street drugs come into Ireland via the ports. It's a big entry point all over Ireland for drugs, particularly cocaine, from South America.
Well, Niall, it's an eye-opener, a depressing eye-opener. Thank you very much indeed.
But help is available if people really want it, Eamon.
Yeah, that's worth stressing. Narcotics Anonymous, I think you were saying, the NA.
It's AA, Cocaine Anonymous. It's online, it's available, it's free.
Fantastic.
Good talking to you, Dr. Niall Campbell, who's a psychiatrist and an expert on addiction. Thank you very much indeed.